culture and policy of the United States is notoriously negligent around mental health awareness and care. This has always been an issue for our country, where the world of confusing titles and qualifications and the cost of care have created a disorienting healthcare jungle where untreated mental illness is prevalent. It is extremely difficult for many to find aid and assistance by the social stigma that surrounds mental illness. Currently, the situation has become even worse. Due to the disarray in politics, public health, and the media occurring in the past year, mental health is as significant of an issue to the American population as it ever has been before. Increasingly, more individuals are at risk of serious mental health issues, yet in the current state of the world, it is much harder than before to find or get help. Mental health care needs to become more accessible by the work of lawmakers and less stigmatized by the work of average citizens. The mental health of everyone, especially youth, in America is getting consistently worse and must be addressed. According to Mental Health America, which is a government-sponsored nonprofit organization striving to increase awareness of problems and solutions for our country's struggle with mental health. From January to September 2020, over 300,000 people took an anxiety screen, showing a 93% increase over the 2019 total number. Over 500,000 people took a depression screen, showing a 62% increase over the 2019 number. Fortunately, to address this, the 116th Congress passed many bills that helped make mental health care easier to come by. This includes the Lower Health Care Cost Act, which made it less expensive and therefore more widely accessible. And while our current policies are changing for the better, clearly, more needs to be done to cater to citizens during the COVID-19 epidemic. A poll from July of this year concluded that 53% of adults in the United States have been negatively impacted due to worry and stress over the coronavirus. Still, the epidemic is only partially to blame for the disturbing statistics. Negligence of the issue of mental health has always been an issue in our society. It was only a matter of time before these numbers skyrocketed the way they have. This increase is also caused by a widespread and extremely harmful mindset that mental health and physical health are two separate issues, with one being more important than the other, and are both equally important to one's well-being. Many mental conditions manifest in physical ways. For example, self-medication of depression and anxiety can lead to substance abuse, and substance abuse can lead to overdoses or even alcohol poisoning. The reverse is true as well, meaning that physical conditions can lead to newfound mental instabilities. One example of this is when a traumatic experience, such as a car crash or an assault, can result in extreme physical harm. Conditions such as acute anxiety or post-traumatic stress disorder can follow. Since both issues clearly have such a detrimental influence on one's overall well-being, we need to expand the definition of primary care in order to include mental health. The connectedness of these two areas, being physical and mental health care, is important in the following proposed solutions. The first being the integration of psychiatric care with primary care. Physicians' assistants should be required to have specialized training in mental health. Primary care doctors need to be trained and allowed to flag patients for further care in the mental health field. Need for more psychiatrists. The costliest mental health care officials will go down. In addition, this is helpful because almost everyone has a primary care facility. People will have direct access to mental health care in a setting they find familiar. The other possible solution is the increased usage of digital therapy and healthcare. This includes video conferences instead of in-person visits and communications through text calls or emails, opting either partially or entirely from physical interactions. This is already slowly becoming more popular. It allows patients to gain care without risking the spread of disease or creating added anxieties, especially with the COVID-19 epidemic. Remote meetings have become the new normal for various meeting types, including classes or workplace meetings. Even further, and coinciding with the issue of mental health, online doctor's visits would be especially suited for those with anxiety or depression symptoms. Being unmotivated to leave one's home are unfortunate factors that keep victims from even being physically able to access the healthcare they deserve. Keeping in mind that remote visits can be completed in one's home, this solution also appeals to those with no means of transportation to a doctor's office. This demographic includes lower-income individuals, those living in rural areas who cannot make those trips regularly, and the physically handicapped. Both these proposed changes are for the purpose of making mental health care more widespread and accessible. These solutions will come with some significant fiscal adaptations. More funding will be needed to provide PAs or physician's assistants with healthcare training. In addition, the added responsibilities will cause salary increases for them. On the other hand, with less direct action between citizens and psychologists, the psychologists will likely see a salary decrease. For many patients, mental health visits and treatment are covered by their health insurance. However, for many with disabilities or with low income, Medicare and Medicaid would be necessary to cover the costs. Additional medical services may cause more costs for patients with subpar health plans. With 67% of Americans having private health care, it is not guaranteed that therapy or mental health care could be covered because they are private, even if it is usually more accessible and less expensive as a whole. For the previously proposed solutions to come to fruition, cooperate with this plan. A bill must be passed stating that for physician's assistants to become certified, they must undergo mental health training. This can consist either of a separate training course designed for the job or additions to the curriculum of those in PA programs now. Those already in the profession can take a training session to catch them up. With this training, patients can receive the first steps of psychological care from their primary care facilities. Appointments and visits with doctors need to partially move to digital platforms. Another bill should be passed, this one stating that all facilities which provide thorough psychological care must be required to give patients the option of online meetings. For those without access to the internet, it is especially important that the firstly listed change is made, and for those with access, appointments via internet can keep them safe and secure during the pandemic, as well as providing further convenience for them. Evidently, our policymakers have work to do to save our country from itself, and its incivil do have a job as well. Between passing jokes, misuse of words like crazy, depressed, or OCD, we're taught that these conditions are something to be ashamed of. Even those close to differently abled ones are also victims of stigma, not just those with mental illnesses. Often individuals even blame parents or caregivers for the already onset of conditions such as autism or the deterioration of their child's development, thinking they should be ashamed and are deemed incompetent as caregivers. They are often avoided or pitied by their peers, even though they don't have the illnesses themselves. Evidently so, even if mental health care and psychiatric care are accessible, there is still clearly a negative social connotation behind seeking mental health that keeps many individuals from taking advantage of resources or seeking any at all. We also may shy away from mental health labels for the sake of our loved ones, lest they become a victim of affiliate stigma that often leads to death. Unfortunately, though, when conditions and symptoms are left untreated, they often become greater problems. Still, the idea of being labeled psycho or crazy is a larger consequence to some than living with their mental health issues. Accordingly, as reported to the World Economic Forum, a recent national survey stated that 51% of Americans with symptoms of major depression in the past year were not receiving any kind of treatment, whether with antidepressants or psychotherapy. To end this tragedy, we need to create a culture that uplifts those who struggle with mental health and encourage them to seek help. The same way someone with a broken bone would visit a doctor and receive a cast, someone with symptoms of depression should be encouraged to attend talk therapy or even prescribed to a necessary medication. There are viable ways to hold our policymakers accountable, but is it possible for us, the common people, to really make a change in any specific way? After all, the only life we really have control over is our own. Change an entire culture of stigma in a single lifetime. It is true that our entire culture can't be changed right now, but we can set an example for the generations to come, since this stigma affects everyone universally. Even if the fight for destigmatized mental health issues does not benefit every single individual, there are ways that can affect people in their everyday life. National medical news journalist Austin Harrison agrees, saying advocacy for mental health awareness isn't just a concern for the people across the world or across town, it has an impact in our own worlds every day. If we respect, tolerate, and care for one another, we will teach our peers as well as the younger generations to come by example. It will take time, but with our combined efforts, a difference can be made. We may not see those changes in our own lifetime, but that does not make our efforts fruitless. The state of our world today makes it necessary for mental health care to become accessible and destigmatized. Mental health is becoming an increasingly potent issue, but is highly neglected by many due to the incapability of receiving help or simply from the shame they may feel towards the topic. To move past these barriers, the cooperation of lawmakers and average citizens is needed. No effort is too small to make a difference. Thinking before we speak is the easiest first step that we can take to make change on an individual level. It may seem small, but something like defending a colleague from an insensitive joke can change an entire individual's outlook towards mental health care. The knowledge that there are people who support endeavors towards mental health and will be accepting despite others' differences is necessary for an atmosphere where members are comfortable addressing their problems and asking for help. Before you make a joke or rude comment, think of how it will affect those around you. And if you hear a distasteful comment from someone else, do not simply be a bystander. Using our actions, we can teach those around us, including the impressionable youth, that mental health issues are nothing to be ashamed of. If they go on to do the same, and so on, we can foster a future free of stigma as a result. With the combined efforts of the common people and those with political power, one day all aspects of our society will hopefully support the validity of those mental health issues, as well as provide them with the proper